Individualized blood pressure for seniors, beyond the normal target. Opening. Before we begin, I would like to share that the understanding presented today is aligned with guidance and research from leading medical and scientific organizations, including the American Heart Association, the American College of Physicians, the American Academy of Family Physicians, and the European Society of Cardiology. These organizations emphasize that in older adults, blood pressure targets should be individualized, carefully balancing cardiovascular protection with risks such as dizziness, falls, frailty, and reduced quality of life. This means today's discussion is not based on opinion, but on modern, evidence-based clinical wisdom, combined with a human-centered and awareness-based approach to senior health. How your awareness can help save lives. Dear friends, today's topic is not just about blood pressure numbers. It is about life, independence, dignity, and safety. Across the world, millions of elderly people suffer silent harm, not only from high blood pressure, but sometimes from blood pressure that is pushed too low, too fast, or without understanding the whole person. A single fall, a moment of dizziness, a fainting episode, a small stroke, a sudden confusion. These are not just medical events. They are life-changing moments for our parents, for our loved ones, and one day for ourselves. Many seniors take medicines faithfully, trusting that lower is always better. But modern science and clinical wisdom now show us something deeper. The safest blood pressure is not just a number. It is a number that protects the brain, the heart, the kidneys, and balance. It is a number that preserves clarity, strength, and independence. Here is something very important. You do not need to be a doctor or a health professional to help save lives. By understanding basic signs, trends, and warning signals, you, as a family member, caregiver, friend, or community member, can notice dangerous drops or sudden rises in blood pressure, recognize dizziness, weakness, confusion, or repeated falls, see patterns that doctors may not see in short clinic visits, encourage timely medical review before a crisis happens. Your awareness can become an early warning system. Your attention can become protection. Your concern can become prevention. This knowledge empowers you to protect your parents, support your spouse, care for elders in your community, and safeguard your own future. This is not about replacing doctors. This is about becoming an informed partner in care. What you learn today has the power to prevent suffering, preserve dignity, reduce emergencies, and in some cases, truly save lives. 1. The old idea versus the new understanding. For many years, people were told, everyone must reach 120/80. Modern research now shows something more nuanced. As we age, the body changes. Arteries become less elastic. The nervous system becomes more sensitive. Balance and fall risk become important. Brain, kidney, and heart circulation must be protected. So for many seniors, forcing blood pressure too low can sometimes be harmful, causing dizziness, falls, weakness, reduced blood flow to brain and kidneys. 2. General ranges. Based on current international guidelines and geriatric research, ages 60 to 69, often safe around 130 to 139 systolic. Ages 70 to 79, commonly 130 to 140 systolic. Ages 80 plus, often 130 to 150 systolic, depending on frailty, balance, kidney function, symptoms, overall vitality. Some healthy seniors may safely tolerate lower numbers. Some fragile seniors may need higher numbers for safety. The body's wisdom is more important than a rigid target. 3. The awareness perspective. From an awareness-based and holistic view, blood pressure is not just a mechanical number. It reflects stress levels, nervous system tone, emotional load, sleep quality, breathing patterns, inner peace or chronic tension. Practices like meditation, gentle breathing, relaxation, emotional processing, heart-centered awareness often support natural regulation of blood pressure without force. This is not a replacement for medical care, but a support for the body's innate intelligence. 4. A very important message. Lower is not always better. Higher is not always dangerous. The best blood pressure is the one that protects the brain, protects the heart, protects the kidneys, prevents falls, supports clarity, strength, and quality of life. Closing numbers, wisdom, and the living intelligence of the body. When awareness becomes protection. Dear friends, blood pressure is more than a measurement. It is a living signal from the body, a message from the heart, brain, kidneys, nervous system, and the life force itself. As we age, the body changes. What protected us at 40 may harm us at 75 if applied without wisdom. True health is not achieved by forcing the body to obey a rigid number. True health comes from individualized care, careful observation, respect for symptoms, respect for balance, respect for the body's natural intelligence. And remember this powerful truth: even without a medical degree, your awareness can save lives. By paying attention, by asking questions, by noticing changes, by encouraging medical review when something feels wrong, you become part of the safety net. Doctors may see patients for a few minutes. You see your parents, spouse, or elders every day. Your eyes may catch what a machine misses. Your care may prevent what a hospital later treats. When modern medicine and everyday human awareness work together, we move from crisis care to protective care, from emergency response to early prevention. May we leave today not just with information, but with responsibility, compassion, and confidence. Not just asking, "What is my blood pressure?" but also asking, "How is my balance? How is my clarity? How is my strength? How is my quality of life?" When we listen deeply to the body, when we respect its intelligence, we do not just add years to life, we add life to years. This is wisdom in action. This is awareness as protection. This is how ordinary people help create extraordinary safety. Professional disclaimer. This lecture is for educational and awareness purposes only. It is not medical advice. Blood pressure targets must be individualized by a qualified physician or healthcare provider. Never start, stop, or change any medication based on this talk. Always consult your doctor for personalized diagnosis and treatment. The speaker and organization are not responsible for medical decisions made based on this content. Thank you. Holistic Wellness Foundation. IMFAL. Healing Beyond Boundaries. Key scientific references. 1. American College of Cardiology, American Heart Association, ACC-AHA. Hypertension in older adults. Clinical guidance to emphasizes individualized BP targets in seniors, considering frailty, falls, and comorbidities. Supports clinical judgment rather than rigid numbers for many elderly patients. Source: American College of Cardiology. 2. American Academy of Family Physicians, AAFP. American College of Physicians, ACP. Hypertension in adults over 60. Practice guideline. Recommends higher systolic targets, for example, 150 millimeters of mercury in some seniors, to reduce harms such as dizziness and falls. Emphasizes shared decision-making. Source: AAFP. 3. European Society of Cardiology, ESC. European Society of Hypertension, ESH. Hypertension in older adults. Notes that very low BP in frail elderly may increase mortality and fall risk. Recommends 130 to 140 millimeters of mercury systolic for many older or frail adults if tolerated. Source: European Society of Cardiology. 4. HIVET trial. Hypertension in the very elderly trial. Landmark trial, showing benefits of treating hypertension in very elderly, but with moderate targets and careful monitoring. Supports individualized, cautious treatment in 80-plus age group. Referenced in multiple guidelines. ESC, ACC, PubMed reviews. Professional disclaimer. This lecture is for educational and awareness purposes only. It is not medical advice. Blood pressure targets must be individualized by a qualified physician or healthcare provider. Never start, stop, or change any medication based on this talk. Always consult your doctor for personalized diagnosis and treatment. The speaker and organization are not responsible for medical decisions made based on this content. Thank you. Holistic Wellness Foundation. IMFAL. Healing Beyond Boundaries.